Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. In today's video, I'm going to be discussing what is frozen shoulder and how do you treat it. So frozen shoulder are also known as adhesive capsulitis, where it becomes very stiff and painful and you lose the range of motion in your shoulder. A frozen shoulder occurs when the shoulder capsule becomes very thickened and very stiff. When the capsule becomes tight, it doesn't allow the shoulder joint to move in the socket properly. And this can cause a pinch pain right up on top when you go to move your arm. The four most common motions that they'll be limited in is abduction, flexion, they'll have difficulty going into internal rotation and external rotation. And a lot of those will cause a pinch pain right up on top of the shoulder. The exact cause of frozen shoulder is not known exactly. They think that it may be caused by either a traumatic injury where you fall with your arm stretched out, and that can cause that area to become injured and swollen and tight, and that will cause the capsule to become tight and stiffened up. Another possible cause of it is if, say, you injure your elbow and you're in a sling and you're immobilizing that shoulder for any extended period of time, that can also cause the capsule to become tight and stiffen up. Another cause of frozen shoulder is when you injure the rotator cuff. If the muscles and tendons become inflamed, that can cause the shoulder capsule to become stiff and tight, and then that can lead to a frozen shoulder. Some people will have a very mild case of frozen shoulder where they can do most of their motions, but once they go above 90 degrees, that's when things really start to stiffen up. And then we'll see more severe cases where they can barely move their arm at all, and it's very, very limited. In today's video, I'm going to show you how we treat frozen shoulder, and I'm going to show you some exercises at home that you can do to help fix frozen shoulder. To treat frozen shoulder, there's two components we want to focus in on. We want to get the patient out of pain, and typically I'm going to use laser therapy to remove the inflammation and to provide pain relief. Then we're going to treat the muscular component, and I typically use two different techniques for that. One is going to be dry needling, and then the other technique is going to be active release technique. So what we're going to do is we're going to demonstrate laser therapy, and then we're going to demonstrate what active release and dry needling looks like. To relieve pain and inflammation in the shoulder, what we're going to use is laser therapy. So laser therapy is going to penetrate deep into the joint, and it's going to help to calm down the irritated area and provide pain relief. This is great because it's a conservative way to relieve the inflammation. You could also get like a cortisone shot into the joint, but you're limited to 3 shots into a particular region, and studies have shown that it can cause premature wearing down of the joint and can cause damage to the tendons. So laser therapy is great because it's a, again, non-invasive way to treat the area, and we can do as little or as much as we need to get the patient out of pain relief. So what it's going to look like is we're going to apply the laser therapy right over the shoulder, and we're going to work the whole joint. We're going to work the back side, the top side, and the front side to get deep into that capsule and to remove any bursitis or inflammation in the joint. And it feels really good. The patient just feels a mild, deep, warm sensation, and it's very soothing. And typically this takes about 6 or 7 minutes to do the treatment. We'll typically do this first to help relieve the pain and inflammation, and then we'll move on to the soft tissue treatment. Now sometimes if someone's very limited and they can barely move their arm, we'll do this actually for a few times without any other treatment just to get them out of pain, because it's going to be very limited, and sometimes the other treatments are going to be too aggressive at this point. Once we get them out of pain, then we can start to do a lot more with the muscular treatments. One of the muscular treatments we're going to use to relieve frozen shoulder is going to be active release technique. So active release technique, basically how it works is we're going to shorten the muscle, and then we're going to contact the muscle, and then we're going to lengthen the muscle. And what that does, it helps to loosen up the muscle and restore the range of motion. What we're going to do is we're going to start in this position, then we're going to bring that across her chest, and she's going to use her other arm to pull the elbow in, and I'm going to contact the back of the shoulder. And this is going to work the posterior part of the capsule. She's going to go across her chest. I'm going to apply pressure. Good, and bring it back. And this often feels like it kind of hurts good. Feels like you're getting into the right spot and relieves the pressure. And again, I mentioned in frozen shoulder, basically the humerus in the socket doesn't rotate appropriately. So with frozen shoulder, you have trouble going out to the side, and that means the humerus is not dropping down in the socket appropriately, and that clears up the space for your arm to raise up. And when it's tight, it won't drop down. So this technique helps to push down the humerus into the socket and help to stretch the capsule. Then we can also work this in external rotation. So I'll put the patient's arm like that, and then she'll lean into it, and then we'll stretch it that way. And those are a couple different treatments we'll do for active release technique. We'll also work the whole rotator cuff to help loosen that up. Another effective treatment to treat frozen shoulder is going to be dry needling. So with dry needling, what we do is we apply an acupuncture needle into a trigger point or a tight area to release that tissue and to improve the range of motion. So what we're going to do is we're going to demonstrate that on the back of the shoulder to show you what that looks like. So one advantage of dry needling over active release technique is we don't have to put the shoulder through a range of motion. So if someone has very limited mobility, we can't often do the active release, or it's very limited, whereas dry needling, we can do the same treatment whether the patient has full range of motion or whether they have very limited range of motion. And that can be very helpful in treating the shoulder capsule. The other advantage of it is it can get very deep. So we can get deep into the capsule right above the bone level, and that can relieve those deeper structures that we can't necessarily get our hand into. So what we're going to do is we're going to place an acupuncture needle in the back of her rotator cuff. So what I'm doing is I'm feeling for the area I want to treat. In this case, we're going to treat her posterior capsule, and we're going to place the acupuncture needle deep into that area, and we're going to work it back and forth. And a lot of times what the patient feels is a little twitch. Okay, and what that is it's a twitch response, totally normal. And what that is, it's kind of like a neurological release of that muscle tissue or that trigger point. And so we're going to place it in various areas throughout the rotator cuff. Now it's a very quick treatment. The needles are in a minute or so and come right out. As opposed to traditional acupuncture where we leave them in for 15 to 20 minutes. This is a very quick treatment because we're going to be targeting the area where the problem is. The needles don't have to be left in for a long period of time. So with frozen shoulder, we're going to apply the dry needling technique all the way around the back of the shoulder, sometimes into the scapular region. Also, we're going to apply it on the trapezius up here because a lot of times as your limited range of motion, you start compensating, and then you develop neck pain and shoulder pain. So often treating this area up here will relieve a lot of those knots and the tension. And then what we want to do is we also want to treat the front of the shoulder, and then we also want to treat the muscles in the axilla area that are part of the rotator cuff as well. So once we decrease the pain and we improve the range of motion, then we want to use certain exercises to reinforce the treatment. So I'm going to go over a few different exercises you can do if you're suffering from frozen shoulder. So the first exercise we're going to do is called the chair stretch. So what we're going to do is we're going to put our hands up on the back of a chair or a countertop. Ideally, you want it to be a little bit higher. That way you don't have to squat down so much. But then what she's going to do is she's going to squat down and hip hinge into it. And what we're doing is we're lightly holding onto the chair, and then this is going to help to passively stretch out the shoulder and the capsule. And what you want to do is you want to do about 2 sets of 10 repetitions. And once you get down to the stretch position, hold there for a few seconds and then come back up. Ideally, you don't want to do it if you're in any kind of sharp pain. So you want to take it to a field where you feel a stretch, but no sharp pain. So the chair stretch is a great exercise for frozen shoulder. So the second stretch we're going to do if we're suffering from frozen shoulder is called a dowel stretch. So what you're going to do is you're going to grab either a broom handle or any kind of dowel at home, PVC pipe works. And what we're going to do, if we're treating her right side, she's going to lightly grab onto the end of the dowel, and she's going to use her other hand to grip the dowel and to force that shoulder into abduction. Okay? So what she's going to do is she's going to, again, lightly hold on with the right side, and then she's going to use her left arm to do all the motion. So she's going to push it up, hold for a few seconds, and then come back down. And again, let's go through range of motion. Now I would do 2 sets of 10 repetitions. Again, avoid any kind of sharp pain. If you can only get halfway up, that's fine. And just work it. And as you do this, you'll increase your range of motion. You'll be able to go higher and higher. So the second stretch to relieve frozen shoulder is called the dowel stretch. The third stretch we're going to do if you're suffering from frozen shoulder is called the arm circles. So what we're going to do is we're going to use that chair again. So if we're going to be treating the left one, what she's going to do is she's going to hold on to the chair with her right arm, and then she wants to move her left arm into counterclockwise circles. And again, just start off nice and easy, and this just let that shoulder hang down so it kind of tractions the arm down like that and stretches out the shoulder. And you can go into a bigger circle there, increase that stretch, and then we want to go about 30 seconds in one direction, and then what we want to do is we want to go in counterclockwise direction and go in the opposite way. Another way you can perform the arm circles is holding on to a little weight. So a 1 to 2 pound weight, anything, even a can of soup will work. And what you're going to do is you're going to lightly grab the weight. And then what we want to do is we want to hold on again. And same principle, we want to just lightly grasp the weight and then go into arm circles there. And what the weight will do is that'll pull more into the shoulder and get more of a stretch into the shoulder capsule and help stretch out the frozen shoulder. And again, what you want to do is you want to go in a clockwise direction and then a counterclockwise direction Do each motion for 30 seconds and then go from there. So the third exercise for frozen shoulder is arm circles. And as the pain and the range of motion improves, then we can do more and more exercises. But those 3 exercises are a good way to start off if you're dealing with a frozen shoulder. So if you're dealing with a frozen shoulder, give our office a call at 703-912-7822, or you can schedule online at novachirowellness.com.